The Charter of Rights has really helped to bring into focus human rights across Scotland's recovery communities and lived experience recovery organisations. Through my work delivering human rights information sessions with Scottish Recovery Consortium, I often hear feedback from participants who have learned content through the sessions or who have become aware of the Charter of Rights, and they've attended sessions through consultation process across the whole time that this piece of work has been developed. And this has led them to grow their own knowledge and understanding of what they can ask for. Knowing our rights transforms what we expect, changes the narrative. It moves us away from the principle of goodwill to actually what we're entitled to. It enables us to challenge poor practice and to support the development of organisations to strengthen their own policies and procedures and move towards an area where they can be absolutely proud of the work that they're doing.
Many of the people that we work with actually wouldn't know that their rights aren't being upheld. They're not aware. I think it's very common for people just not to be fully aware of what their rights are. And if you're not fully informed on your rights, then how are you in a position to ask for help around a right or challenge a matter? So actually being very, very clear on what your rights are is key to be able to level the playing field in conversations with people that are making key decisions about your life, about your rights, about how you live your life day to day, about maybe taking away rights from you, making changes to things that are important to you in your life, providing you with treatments that if they're not right for you and you've not got a view on things, then they're never going to be right for a person. So being really informed on your rights and being included and being at the heart of decisions that are being made together with services is absolutely key for people.
The Charter of Rights sits very well with the work that we do at Equality, where we make sure that people's human rights are upheld. To help implement the Charter of Rights, there's a toolkit that sits alongside the Charter. We find in Equality that the work that we do sits naturally with some of the tools that you're encouraged to use. So for us, that means participation. So we make sure we involve the people that we work with, and they're at the centre of the work that we do. And we make sure that we help them navigate the complex systems and perhaps legislation that are affecting them. We evaluate the work that we're doing. We discuss that with the people that we work with to make sure that they're definitely at the centre of any of the work that is taking place. And we make sure that we represent fully the views and the thoughts of the people that we're working with. I got a referral recently for a man who was moving from a temporary furnished flat into a permanent address. Unfortunately, the flat that housing offered him, he felt put him at risk of relapse. Through discussion with housing and making them aware of the person's right under the Charter of Rights, I think it changed the way that they thought about the way that they were working and perhaps considered a more person-centred approach to their practice. The outcome was that housing reconsidered their offer and offered the person a house in an area that he felt he was less at relapse of drugs.
The Charter is a really easy read. It's obviously available in different formats, different leaflets, different kind of posters, but it's an easy, clear guide as to what rights there are that people can just look at and say, oh, okay, I have the right, for example, to an adequate standard of living. What does that mean? What does that mean? Because I don't feel that I've got an adequate standard of living. I give the posters or the leaflets out to people quite regularly, and I think it helps them to understand that someone somewhere has thought about my situation and what difficulties I might be going through, and how perhaps I shouldn't be, or how something can be done to make things just a little bit better for me.
The more people know about their charter rights, the more they can help defend themselves and help other people. And I think a lot of times people don't learn about things because they're not readily available. In certain lifestyles, you're not out and about looking at books and journals and that, and a lot of these things have to be taught via word of mouth. We've done a couple of presentations now for the charter rights, and I was surprised at how many people didn't actually know their rights. These are people that work in services such as ADP and that. So in my opinion, if they don't know their rights, how can they advocate for people on that behalf? So I think that bringing the charter rights out and letting it more known to people in videos like this will bring awareness to people, and obviously just try and heighten the problem with stigma and people with substance abuse, because obviously it's a national crisis at the moment.
For example, on opiate substitute treatment, you would normally just come in and be told this is what you're going on. But now people are aware that they have the choice of medication and are a bit feeling more comfortable in asking about the different choices. And I think as staff as well, like it's had a really positive impact on staff. They're now aware of rights as well, and that the people that we support have rights, and that as part of their responsibility and my responsibility and our roles is to highlight those choices to everybody from the moment that they come into service to the moment that they decide to leave service.
Knowing my rights has definitely made me more confident in understanding what services should be providing, and confident in asking for that if I don't feel like it's been delivered. A lot of people who are still struggling in addiction really struggle with like feelings of stigma or barriers to engaging with services, and relatability. I think that's a big barrier for a lot of people is, well, that person, I can't relate to them, they don't understand me. So I think lived experience and peer-to-peer support gives a really good way of tackling that. And I think the fact that the Charter of Rights was created by a national collaborative of people with lived experience and from different backgrounds is really powerful, and it helps get to the roots of what the issues are in our society and dealing with these issues.
I'm a family member affected by someone else's substance use. When you've got a loved one that's been discharged from hospital and you're not involved in that, it's very chaotic. Has a big impact on your life, had a major impact on my life. So to know your rights in that made a huge difference to me, that people in services would then listen, that I knew my rights a wee bit. So the difference in the way you were treated by a lot of different, like hospital staff or social work or all these different areas was so different when they thought that you knew what your rights were. What I would say to anybody in a similar situation to what I went through and my experience of knowing your rights through hospital or mental health or any of these different situations is find out what your rights are, find out your human rights, find out everything you can about what your rights are and your family members' rights, that it just gives you a voice. It gives you a voice and you're heard. You're heard for, because a lot of the time you're not listened to. You're invisible.